Welcome, everyone. Good afternoon to the church and the coronavirus. This is our second installment from the Lake Union Conference, where we're covering issues of interest to our community. Today, we'll be discussing physical and emotional well-being during this quarantine period. I'm Debbie Michelle. I serve as the Associate Communication Director for the Lake Union, and I encourage you at this point to start sharing this. This will be a time in which you'll have lots of information that will be of value, so you'll want to hit that share button now on Facebook. You'll also have an opportunity to pose questions to our panelists, our panel of experts, and I'll just want for you also to, at this point, introduce you to my co-moderator. That is Randy Griffin, and he serves as our health director at the Lake Union Conference. The Lake Union Conference is one of the only conferences, I believe, that has a full-time health coordinator. And so we're so excited that he'll be on this, he'll be co-moderating this as well. Randy.
Debbie, thank you very much. Thank you as well from my end for joining us today. We're glad to have you on. I do want to pause briefly and thank also Nick Miller last week for starting this type of seminar for our church members, but also those that might be interested otherwise. So thank you, Nick, for that. It was interesting to follow through the coronavirus is not Revelation 13, but it's Leviticus 13. We need to act like it's 1 Corinthians 13 until Romans 13 comes along. So I appreciated that bit of information there. From that presentation is where there were a lot of questions regarding what can we do about our health? What is this coronavirus? What is it? What can we do to keep it away from us? If we do catch this virus, what are things that we can do to try to keep it at bay or get it to go away faster? So that's where this seminar here today has spawned from that request. We are in an unprecedented situation right now where, we have church doors closing. We've learned how to do online worship. We've learned a lot about Zoom. We're seeing schools closed. I have a son who's attending an academy in Michigan that he's had to be at home. He's missing his friends. He's learning how to do things online. You think of these schools that just do not have the technology or the means, where it's just a very strange time that we're in. When we started earlier in this week, I was looking at the statistics for how many people have contracted the virus, how many people have died. Those numbers change daily. In fact, this morning I was looking at numbers. Right before we came on, those numbers have even moved higher from that. So as of right now, 185 countries are affected by the virus. 1,760,978 confirmed cases. Now that's just confirmed. That doesn't mean that the number is obviously going to be a lot higher because not everybody's being able to be tested. 107,750 deaths. Just comparing those numbers from even a week ago, some of them doubled, tripled, quadrupled. Just very unusual times that we're in. So people are very interested and they are ready to listen. They're ready to hear what it is that the Lord has to offer, what the Bible has to offer, and some of the things that have happened in past history that we'll touch on that worked then that we can try to help us to navigate this unusual situation right now. So here's a great opportunity we have to share the hope, share the healing through the power of Jesus and his word. Before we begin, I do want to offer a word of prayer and ask the Lord to be with us in our discussion here today. So let's bow our heads and have a brief word of prayer. Father, what a comfort it is to know that you are in control. If it was not for that comfort, I think we would all be much more stressful and worried and just not know what to do. So thank you for your word, your sure word of prophecy. Thank you for your word to guide us in all things, and especially here today in this discussion, how your word can help us with health, with our bodies going forward. Lord, we ask for your blessing in this discussion. We love you, Lord. Amen.
Amen. All right. Thank you, Randy. And so I will introduce to you our panel of experts. On the panel, we have Dr. John Kelly. He is the founding president of the American College of Lifestyle Medicine. Dr. Kelly is certified in preventative medicine with degrees in epidemiology, biochemistry, molecular biology, and he serves as faculty at Loma Linda University, and his area of specialty is how lifestyle choices affect our genes and well-being. We also have Dr. Kimberly Hazelton, and Kimberly is from Michigan. She did her undergraduate education at Weimar College in California, and then she went on to study medicine at Loma Linda University. She's currently a resident at Memorial Family Medicine in South Bend, Indiana, and is certified in lifestyle medicine. After her residency, Kimberly plans to start a family and lifestyle medical clinic in collaboration with Michigan Pastor Phil Mills. We also have on the panel Dr. Melissa Ponce Rodas, and she is an assistant professor of psychology at Andrews University. She received her bachelor's in psychology from Yale University and her master's and PhD in psychology from the University of Illinois, Chicago. And her PhD dissertation was, "Where should they go for help? Religious women's feelings about different helping resources for victims of domestic violence." She also has training in mental health counseling and is a regular contributor to the Lake Union Herald's Family Focus column. So I'd like to welcome our panelists. Just to give you a foretaste of what the next issue of the Lake Union Herald will be featuring, of course, it will be talking about what we've been going through during these times. And so there will be an article by Doctors Kelly and Hazelton. And so you'll get a taste of what will be coming in that issue when it arrives in your mailboxes later this month. And so I wanted to start off because this is something that has affected us all. And I wanted to find out from our panelists, how has this pandemic affected them, and how has it changed their practices or behaviors as far as health is concerned? You know, when I look at myself, one of the things that has happened at this stage is that I'm finding more and more in terms of for my mental health to be able to make those connections with loved ones who are not around me. So I'm checking in more and more with family that's in New York, in Georgia, just to make sure that everyone is well, because I mean, you're hearing those numbers. And as you mentioned, Randy, I mean, every day those numbers keep going up and up. And so checking in on those older members, especially, and seeing how they're doing during this time. So I was just curious to know, and especially as health practitioners, what are some of the things, perhaps the behavior that you are changing at this time in relation to this coronavirus? And you can start with anyone. Maybe you can start with Randy, and then we can move to the panelists.
Well, I know that one of the unfortunate aspects of how this has changed my the work that I do for the Lake Union, I've been facilitating dental, vision, medical clinics for the past 5 years. So unfortunately, that had gone by the wayside because there's a lot more than 10 people showing up at those clinics. There's hundreds of people looking for the care. From a standpoint of at home, personal life, I'm not going to say it's changed it for the worse. It's actually probably given a little bit more time to be at home, to be with family, to take walks with my wife. I got the bicycles down and actually got them out after a couple of years of sitting on the shelf. So there is a silver lining on the edge of the dark cloud, but a lot of people probably don't have as good of experiences because they're at home a lot more now. And I know we'll touch on that here a little bit later as well.
Okay. All right. And maybe we can start with the ladies. Maybe we can start with you, Dr. Hazelton.
I don't know that a ton has changed. We've been doing a lot of planning in the clinic, and there's a lot of apprehension of what'll surge look like. We've not been guaranteed any weekends off between now and the end of our residency year, which is the end of June. So it's kind of really thrown like a lot of apprehension and kind of a monkey wrench in the end of our training, depending on what surge will will look like in the hospital, because we spend a lot of time in the hospital. So it's really made me think of like, okay, really important about self-care. I typically ride my bike to work, and it's finally getting sunny outside enough to not risk the snow. I just have to dodge the raindrops every once in a while. And I like to garden. I took the risk and planted snow peas a couple days ago. So hopefully we don't get a super hard frost, because I love gardening. And they're already tasting good in my mind already.
Okay. All right. And Dr. Hans Rodas.
Sure, I think I have a very different experience. I have twin 8-year-old boys. So they've been home from school for about a month. So during the day, I'm pretty much spent taking care of them. I think one of the hardest things has been that I work at Andrews as an assistant professor of psychology, and we had to send home all of our students. So I miss them. I'm still working with them, trying to get them to finish up a semester. Technology and I are not friends. For those of you who are learning Zoom, I'm still struggling. And so I try to put up assignments for hours, and then it doesn't work. So it's a little bit, definitely, I've noticed more stress, more anxiety. I'm originally from New York. I have most of my family there. I have a lot of people who are older and immunocompromised. So there's a lot more checking in. And even here, I might have forgotten to tell you, I do some work with the local hospital, and we work a lot with low-income communities where people don't have internet and they don't have health insurance. And so we've been really trying to get at those vulnerable populations. And so I've actually been a lot more busy, but with a lot less time with 2 kids at home as well. So.
Okay. All right. And Dr. Kelly, how about you?
Yes, it definitely has changed my life dramatically. For me personally, since I do a lot of speaking, very much like Dr. Randy, my life is completely, all my calendars went completely blank. I don't have any appointments all the way through July, I think, or maybe, and there's question about the ones after that even. So it took a while to adapt to that. And we've been doing more, actually my wife and I started doing some presentations in our home on video that we could then, people could see. So that's been a new thing, like Dr. Melissa talking about learning Zoom. I just had to learn how to use the camera on my laptop, and anyway, it's really interesting. One other thing though is that I'm also president for the Oak Haven Country Life Natural Foods in Pullman, and our business has gone through the roof. We have way more business than usual, people wanting the healthy foods that we market. Country Life Natural Foods is a large Adventist ministry that supplies healthy food. And so we have really been super busy. Anybody who's out of work and needs some, just give us a call. We could sure use help.
Okay. All right. So I want to begin by asking in terms of, the basics at this point, and maybe Dr. Kelly, we can start with you in terms of the coronavirus. For those who might still be trying to figure out what is this, what can you tell us? What is this virus? What do we need to know about it?
Well, of course, the virus is something, they call it novel coronavirus. So this is a virus that is new to human beings. And I mean, there's so much information online that's available, and the vast majority of it about the virus, I think, is good, certainly from the CDC and so forth, the reliable sources. But in a nutshell, this is a virus that has jumped from, the best we can tell from looking at the DNA and what it looks like, it's about, I think, almost 90% from a bat virus, and the belief is that it jumped from bats to another animal and then to humans in a market there in China, in Wuhan. I don't think that to be very honest, I don't know that we know this. This is our best guess. It's just like when the SARS and some of the other viruses that have come up in the past, really it takes a few years for us to completely analyze and know exactly. But the key thing is to know that this is a highly contagious. This virus spreads very easily, apparently, and it has a wide variety of effects. Some people actually are asymptomatic. They will catch this virus, they have it in their body, they don't even know it. And it goes all the way to the other extreme. You have people who get the virus and it can actually kill them. Fortunately, that's a very low percentage. The thing that you mentioned, I think, or someone mentioned earlier is very important. I think maybe it was Dr. Randy, was that when we're talking now about cases, we're talking about known, diagnosed cases, the cases that have been confirmed with a test, usually a blood test. And so that's a gross underestimate of how many actually there are. We know that there's at least double, maybe as many as 5 times, somewhere between 2 to 5 times as many cases as we've actually been able to count with the tests so far. And the reason that's important is 2 things from my standpoint. As an epidemiologist, that's important because once we have about 75% of the population has caught this bug, or then we have what's called herd immunity, which means we have a much less risk of having an epidemic if it starts up again. The other thing that's important is that the death rate is considerably lower than it seems right now, because the number of people that have been tested is showing a lower number than the actual number of people that have it. I do not want to minimize the seriousness of this disease. COVID-19 can kill you, but the good news is that it's not quite as deadly as it seems right now based on the numbers we have.
Okay, all right, very good. Maybe Dr. Aselton, maybe you can tell us in terms of what are some of the steps that people can take to protect themselves, some basic things at this point from this disease.
Sure. So I think going back to what they mentioned last week a little bit about Leviticus 13 with the sanitation practices. That was unheard of in that day, and Bible inspired book way ahead of its time to recommend quarantining and separating those with contagious diseases. And as Dr. Kelly mentioned, this particular virus is spread, we think, by respiratory droplets. And let me see if I can just share a visual, and you'll understand why it's important. We try not to, sharing is normally caring, but in this case, probably we don't want to be sharing our respiratory droplets. And so just as a visual here, hopefully that's working. When we're talking, when we sneeze, when we cough, there's little respiratory droplets. And like Dr. Kelly said, oftentimes we're asymptomatic and we may have been exposed to the virus, and we could be shedding the virus in that kind of incubation period, and spreading it to others. And which we don't want to do. That's really important to also wash our hands. And interesting study looking at how long does coronavirus last on surfaces. Can it be spread on surfaces as well? And we should really be cleaning our surfaces. So thought to last longest on stainless steel and plastic. So not only should we be keeping a physical distance from other folks, we should also be cleaning our surfaces, and then we should be washing our hands as well. So when we touch surfaces and we may get the virus on our hands, try to washing our hands frequently with soap and water. I'm an impatient person, and it's very tempting to just kind of like quick wash the tips of your fingers, but we should really be washing our fingers or washing our entire hands for 20 seconds, or singing the happy birthday song. And if you're not you don't have a good voice, well, then you'll be annoying everyone, but you will have clean hands. And so some ways that we can try to prevent being exposed to the virus is a good start. And obviously we'll be talking more about ways we can prevent it if we are exposed.
All right, perfect, thank you. And so I want to go to Dr. Melissa. If you can just tell us in terms of from the mental health standpoint, what are some of the things that we need to be thinking about when we think about the coronavirus?
Sure. I think that one of the things that we really need to be thinking about is that, first of all, this is affecting everyone. Sometimes there may be illnesses that affect some of us, but not all of us, or natural disasters that affect some people in an area. But this is really a global issue right now. And I say that because it's important to know that everyone's mental health is being changed and challenged. And mental health is something that we usually don't talk about. We don't think about how stressed we are, or is my mood very different today than it was yesterday? And the fact that this is a global pandemic that all of our friends and family members are trying to change in one way or another means that stress is higher among all kinds of people, anxiety levels. I'm hearing a lot of people who are having anxiety issues, even to the point of panic attacks, where they can't go into stores because they're just so afraid. I mentioned I have 8-year-old twins, and we went to go to get some groceries a few days ago, and we were going to go through a drive-through. And my son, when I tell him to put on his shoes to go outside, he goes, "Mommy, we can't go." And I'm like, "Honey, what's wrong?" "Mommy, the coronavirus is outside and it's going to get us." And how do you explain that to an 8-year-old to tell him it's okay, we're going to be safe, these are the precautions we're taking, like Dr. Kimberly was talking about, and still go through your day-to-day, and we need groceries because we have to eat. And in lovely Berrien County, there isn't many delivery services like if I was in New York or someplace else. So I think we need to be just very cognizant that this is impacting everyone, and it's impacting the way we deal with each other, the amount of patience we have with each other, the level of stress we have with our spouses, with our children, in our houses. So we need a lot more understanding and grace, if ever, to try and deal with some of those things, and also some better coping mechanisms, probably.
Gotcha. So talking about, what can we do? And this is not the first rodeo in terms of with a pandemic that we have experienced in the United States. 100 years ago, 1918, 1919, there was a flu, global, millions of people died. And so perhaps there's some lessons from this. And perhaps Dr. Kelly, you might want to tell us, have we learned anything from this? Is there anything that we can take away from that will help us get through what we're going through now?
Well, there certainly is. And I think I would like to let Dr. Aselton speak first a little about this, and then I'll add a couple of things.
Sure.
Is that okay, Dr. Aselton?
Sure. So we've been passing forth this fascinating article back and forth, and it's gotten some unique things going. Let me just share. So I think, like Debbie mentioned, 1918, 1919, there was this, flu epidemic. That was during World War I, and it is also called the Spanish flu, simply because that, no one involved in the war, Spain was neutral, no one involved in the war wanted to share their numbers to know how crippled they actually were. So really, is the estimate of 50 million to 100 million deaths really accurate? Well, a lot of people died, but a while back, when I was doing a pilot training program in gospel medical evangelism, one of the other coordinators put this article on my virtual desk, and it was interesting. It was about what they did at the Spanish flu in the sanitariums of the day, so kind of like the Adventist hospitals. And I was like, oh, that's interesting. And well, okay, when this came about, I went back and dug around for it and finally found it. And so this was in May 1919 in Life and Health. It's an old Adventist publication, so not a scientific journal. And they surveyed 10 different sanitariums, and all these fancy old pictures of these old hospital beds and such. And these sanitariums reported some interesting numbers. and they compared it to the Army hospital of the day. So Army camps is where you'd expect maybe everyone to kind of pull their best resources, the healthcare workers and such. About 16% of those in the Army camps, per the official report, which the official report didn't actually include the full number of influenza cases, but they said 16% got a secondary pneumonia, which is thought to believe how most people in the influenza epidemic died. And of that 16%, about 40% of those died. And then if you go over to the home hydrotherapy, so this was some of the methods that they were using in the sanitariums and in the homes. And Dr. Kelly can speak to this more, what they were doing. But they treated 677 of these folks in their homes. And about 8% of those were got a secondary pneumonia, or kind of the scary and severe complication of influenza. And of those 8%, again, 47% of those died, so a high mortality. And then the sanitarium hydrotherapy, so these were like nurses, employees, and regular patients of the sanitarium. And it mentioned that they were treated aggressively and early with the sanitarium methods and the hydrotherapy regiment. And so 446 got that kind of aggressive early treatment, and 2.4% of those got the secondary pneumonia. Of course, this was clinically diagnosed pneumonia. And then of that, again, 54% of those died. So again, a high mortality rate. So it's interesting, hard to interpret these numbers because we don't know a lot about details, a lot about these patients, and not a scientific journal necessarily, but it is interesting that what they're reporting is that so many of those treated with the sanitarium methods early and aggressively didn't get the secondary pneumonia that was so dangerous in that day. I think last week they had mentioned the Hutchinson article from the Northern Union Reaper that reported early aggressive treatment of the influenza at the Hutchinson Seminary in Minnesota. And of the 120 students, 90 had symptomatic influenza, and they were treated aggressively early, bed rest, nutrition, as well as a hydrotherapy regimen, and none of them got a secondary pneumonia, which is interesting. You know, it's interesting historical information that really makes you wonder how relevant is this for today.
Yes, thank you, Dr. Azelton. And I would like to share now a couple of slides, because there is, let's look at how that would apply into our current situation. Let me see if I can share my slide here. So are you able to see?
Yep, you can see
that. Okay, I'm not showing. Okay, so if we think about the COVID-19 interventions, I want to point out 4 phases of treatment. First is the pre-infection prevention, and we'll talk about what we should do briefly, very quickly on each one. But second, the second is when you have a presumed or confirmed early infection, and this is where we have outpatient treatment. Then the third phase is when we have confirmed late infection. This is where symptoms develop and become serious enough that we have to take care in the hospital. So we have inpatient treatment. And finally, some of those cases, hopefully not many, but some of those definitely become very serious and need ICU treatment. That's where the ventilators we've been talking about come from. So now let's just look at what we should do in each one of these. So thinking first about the pre-infection, the most important thing is actually lifestyle interventions, having a healthy lifestyle, diet, exercise, etc. But as far as hydrotherapy, which is what we're talking about here today, contrast showers have been shown to be very effective at keeping our white blood cells and immune cells circulating, and saunas. Another thing that's very useful can be hot saunas. The next would be the talking about now presumed, excuse me here, presumed or confirmed early infection, outpatient treatment. Then we need to have more intensive lifestyle interventions. But from hydrotherapy standpoint, hot fever baths, steam baths, or fomentations. And I'll talk a little bit later, perhaps, about the details of doing a couple of these. Then when we have the late infection, when it's time that we definitely need to go see the doctor, go to the hospital, fomentations and hypothermia are effective there. And I know some physicians who are actually starting to use these in the hospitals and doing careful outcomes tracking to see the effectiveness of these treatments. And of course, there's actually some hyperthermia that's being used in the ICU setting, where studies have revealed that allowing fevers to run higher instead of trying to keep the fevers down is actually helping to fight the virus. So these are the four phases that I wanted to talk about. And like I say, I can share a little bit more later about doing the actual treatments. Let's see, how do I stop sharing? There we go.
Okay. Yeah, I think it would be interesting and would be good for us to get some more details. I know that I had questions in terms of what's a contrast shower and the fomentation, et cetera, et cetera. Do you think that this might be a good time, Doctor, to perhaps go into some of those specifics?
Sure. Well, sure. I'd be glad to. I do have some more slides that are talking about the actual, how these things are done. Sure, let me do that. So I need to share, go back and share. Okay, so I want to go, this was where I was talking about the four phases. So let's talk about then one of the things that we mentioned that we can do that's been effective before you get a virus, before you get sick, to keep your immune system at peak. And so here's an illustration where we have a shower, and you can see the temperature is on the x-axis, okay, from 40 to 120 degrees. Typical body temperature is around 98 here. And then the minutes of treatment on the x-axis. And so we're gonna, zero is where we start the treatment. What this graph shows is basically we take a shower, we do our normal shower perhaps, and then, because it doesn't have to be something that's done separately. It's easy to do it in the morning when you're taking a shower, or in the evening. And then when the treatment starts, we raise the temperature up so that we have a hotter than what we've been using for our normal shower. This is going to somewhere around 105, 106 degrees. And then after about 3 minutes, what we do is we drop the temperature rather suddenly to cold. We turn off most of the hot and use cold. And you can see this is going down to about 65 degrees is what's suggested. Ideally, the cold should run on the nape of the neck. Once you turn it, you need to turn around and let the shower head shower on your neck and your back. And what the experts have told us is what we're looking for is one of those inspiration effects where you have, ooh, this is cold. And then 30, 35, 45 seconds at most, you turn the temperature back up. It's really nice if you have a shower that has the single lever control. It's really easy to do this. And then again, you can see it's slightly increasing. We try to increase the temperature a little bit more, maybe up to 108 degrees. And then after 3 minutes, dropping it again and having actually the benefit here to the cold is not so much that it changes the temperature of your body or of your skin, although it does. It's actually the tonic effect that it's stimulating the nervous system that seems to be a big part of how this works. And then we go back up again for another 3 minute period, and we probably don't want to go over 110 degrees, and then drop it after 3 minutes. Then we go back up and come down over a minute or two period to a neutral temperature. So this is oh, I should have gone to the second slide. Here's a little bit more detail, but same basic thing. So there's one other treatment I think I want to mention, and she mentioned here, this is the same journal from May of 1919 that Dr. Azelton mentioned. And here is a picture from that of a patient that's in the bed, and the nurse is putting a hot foot bath to warm the feet and warm the body at the foot of the bed. And then over here on the right-hand side, there's a picture. She's actually making one of these fomentations, which is a moist hot pack. So let's talk about the fomentation, or a moist heat pack. So the subject is lying on the back with plenty of covers, as we saw. We want to keep the patient warm. In fact, one of the things interesting about what they did back in the Spanish flu pandemic was they say they treated the patient as soon as there were any symptoms as though they had pneumonia. So they were going quickly to a very intensive treatment and not waiting for the pneumonia to develop. So there's the hot foot bath, the temperature 104 to 110. It's recommended we keep it down at 104 degrees if it's a diabetic or someone with neuropathy, meaning they don't have good sensation in their feet. We don't want to burn anyone and hurt them. We use a cold terry cloth to the head. It's important to keep the head cool during this warm-up, because one of the main things is it makes the treatment much more enjoyable. If we do not keep the head cool, the person is perspiring and feels it's very unpleasant, and it is safer for the brain as well to keep it cool. We use a hot, moist heat to the chest, so we wrap hot packs in towels. We saw that, and we don't want to burn the skin. We place one fomentation under the spine, and basically that they lie on this, and it's from the nape of the neck down to the pelvis, so down the entire back if possible. We place another hot, moist heat pack across the chest and cover the subject with blankets while this is sitting on the chest. So we're applying heat from top and bottom. Then here's the picture of actually from that same journal of them putting the heat pack on the chest. And then we're going to replace that top one, that fomentation pack, every 4 to 5 minutes. And we're going to rub the chest with a cold terry cloth between exchanges. This helps to keep the heat from being unpleasant to the person, but it also helps to lock in some of the heat as we put the cold briefly on the chest. We continue with this for 3 or 4 exchanges of the fomentation on the chest until profuse perspiration. If the individual gets quite warm and the cold on the head is not keeping that down, then we need to end the treatment. And we would end with a cold terry cloth rub to the chest again and cover them up with blankets. We'd pour some cold water over the feet and remove the foot bath. The cold water just helps seal in the heat that's there, and bundle them up. We keep the cold to the head until the perspiration subsides during and bed rest. And ideally they would sleep after this. I think we're maybe running short on time, but you can also accomplish a similar thing with a hot tub bath. And in essence, you get in the tub, you cover your body with a towel, the part that cannot be underwater, and keep pouring hot water on that. You put ice on the head. You want to keep an ice cold water wrung out, a rag wrung out on the head. We usually do this 30 minutes or less, or again until profuse perspiration. We finish with a cold rub. We call it a cold mitten friction, but it's being done with a terry cloth, like a washcloth. Then we make sure we put on warm clothing and a blanket wrap in the bed. So we're going to really go to bed and try to keep this heat, because what we're after is we want to prolong the elevated temperature, keeping cold to the head during all this time. And maybe at the end, we oftentimes have a brief neutral shower because you've perspired quite heavily. But it's amazing how pleasant it can be if the head is kept adequately cool. And yes, as I was mentioning, the hyperthermia, it induces a sort of a fever-like immune response. You know, the doctors have realized now that that fever, in the case of fighting a viral infection, is not the enemy. This is actually part of the body's way of fighting it off. And so doctors are now allowing the temperature of people with COVID-19 or with the SARS-CoV-2 virus to let their temperature run up higher, say 103 or so, and it's actually helping to fight it. The other thing I mentioned was start as vigorously as early as possible. As soon as you feel like you're getting a sore throat or you're getting a cold or something, don't wait and wonder. Go ahead and start doing some of these simple treatments. And the other thing is we should follow all of the lifestyle health principles that we know we should be doing. If there's any doubt in your mind about how important those are, they help potentiate the treatment. So thank you for the chance to share some of that.
Excellent. It sounds very simple. And the thing that I'm wondering, is this something that you recommend anyone, or is it something that should be done under the supervision of a professional?
Well, actually, that's a great question. And the answer is that if you have underlying comorbidities that are quite serious, let's suppose that you have a heart condition and you have high blood pressure or you have other conditions, then I would recommend you not try to do this to yourself, that you get someone to help. In fact, if we have a chance later, we'll be talking about a training class that we're offering so that people can learn how to help their family members or neighbors. But the one thing I also want to say, thank you, and maybe Dr. Hazelton was going to touch on this. If you do, you can come in right behind me here, Kimberly. But I think it's important we also realize we're not suggesting that hydrotherapy or hydrothermal therapy replaces the need for medical care. What we're talking about is it accentuates it, it's an adjunct, it actually potentiates the care. And it's also something that we need to do early on, not later. I mean, they're actually using fomentations in some hospitals in the hospital care. But so I'm just saying that validates its medical value, but it doesn't replace. And if we get, let's suppose I've been using cold showers, contrast showers, and you know, and then I start getting symptoms, and I think, oh my, I've caught it. I'm getting sore throat, maybe cough, and so I start doing the fomentations or the hot bath. If that continues to get worse, and I get to where I am getting fatigue, I'm clearly not licking this thing. It's post haste time to contact our doctor or go to the ER. And so we want to make that clear.
Dr. Kelly, we've had some viewers asking if they could have copies, or somehow if they could have the slides that you've presented there. Is there a way that somehow we can post those on the Lake Union website after this presentation is over? Yeah,
absolutely. I have a PDF of them, and that's the way anybody you know, could view them.
Okay, at the end of the presentation, then we'll provide a website where you can go and find that information there. I do have a question regarding this is primarily probably to Dr. Melissa. What are the signs that we may not be coping well during this stressful time? And another term that I've heard this week and last week is the social distancing is maybe getting out of favor and maybe to a better term. So can you address those questions for us?
Sure. I think that social distancing has been put out there, but people are mistakenly understanding it for we shouldn't have anything to do with other people. It really, a better way to explain it would be physical distancing. I can still call my mother every day. I can Zoom with her. My kids wake her up in the morning with a phone call, but they're not physically with her. And that's what we're looking for, because as the other doctors have mentioned, the transmission is so easy in this case that we don't want to be physically near. You saw the slide about staying 6 feet apart. Because of those respiratory droplets, you don't want them in case someone is, especially if they're sick and asymptomatic, you just don't know. But humans are social beings. And if we don't have social connections, if we really are socially isolating ourselves, our mental health is going to suffer. We cannot be away from people. I can take this in a slightly theological standpoint, but humans were not meant to be alone. That's why we're meant to worship in groups, and that's why we have families. And everywhere you look, there were social units that are meant to keep us together. I know, for example, for me as a parent, I really rely on other parents to tell me, this is normal, you're okay. My kids also want to jump off the furniture at this point. And if I didn't have that extra support or frame of reference, it would be kind of hard to cope with things on my own. So we really prefer the concept of physical distancing as opposed to social distancing. So does that answer that part of the question? And then I think the other part was you were asking about how would we know if we're not doing well?
Yeah.
An important thing to remember is that psychologically, we're all at different points. We kind of all have a different normal. I'm a little jealous of Dr. Kimberly and Dr. John because they can talk about 98.6 is an average temperature. I can't tell you what an average level of anxiety is because for everyone it's different. But if you know where you're usually comfortable, and say, for example, you're not falling asleep as quickly as you usually do, you're not having uninterrupted sleep. I'll say this again as a parent, if usually you can handle your kids' outbursts, and lately you're just extremely short and you're just like, I told you to do it and why isn't your homework done? Seeing more of that, you can also see people become more withdrawn, more kind of socially isolated. I don't want to talk about it, leave me alone, I want to be in my room. Those are all signs that your mind isn't reacting the way that it usually does, and it may be under additional levels of stress, and you may want to do something to kind of be aware of it, and then find some coping mechanisms to do it. I know it's hard because we have to change those because we are physically distancing. One of the ways I used to cope was I used to go outside and just go for a walk at Walmart. We have a lot of snow here in Michigan, so it wasn't quite going outside. I can't do that anymore. So what do I do? Where do I go? I'll be very honest. The bathroom is a place that I tell a lot of people to go just for a few minutes. If your kids are stressing you out, it may be the only room in your house with a door. Go in there, take a few minutes, breathe, call a support person if you have to. I remember when my kids were little, I would call my friend and be like, I don't know what else to do. These kids won't stop crying at the same time, and they're fed and they're burped and they're fine, and I don't know what to do. And she would say, calm down, take a breath, it's okay. Are the kids safe? And I'm like, yes, they're fine. I would calm down, and I was a much different mom to go back and take care of those kids than if I didn't do that self-care. So we kind of have to find new ways to cope, new places to de-stress, new ways to support each other.
So I know that Dr. Melissa, one of your area of specialties is domestic violence, and that's one of the areas that seems to be alarms are going up about it. I know that, for instance, in New York City, there was a domestic violence resource website that said it saw its visitors double, between March 18th, March 18th, April 5th. And then also we're hearing about in China, which just went through this lockdown, and now that they have opened things up again, they're noticing that the divorce rates have gone up. So we're seeing some of these issues that are coming up. And so I wanted for you to address, what are some of the things perhaps that we need to be paying attention to now before, things get out of hand, whereby we're having issues of domestic violence and divorce. And I know that those are two separate issues, but if you can talk about some of those things.
Sure. One of the big things with domestic violence is whenever we see changes in the economy, and there's a huge time of financial stress because a lot of people are losing jobs, unemployment rates are skyrocketing, people aren't paying rent, mortgages. So financial issues are a huge risk factor for domestic violence, where one member of the couple is using power and control to try and cope, not healthfully, but unhealthily cope with the situation, which oftentimes results in emotional violence, anywhere from yelling, insulting, you can imagine where that goes, to physical violence, to sexual, intimate violence, financial violence, and all of those things rise during crises, during times of pandemics. So you really want to be looking for changes in yourself, changes in your partner, having a safe person to talk to, a safe place to go, knowing what resources there are. And I know Dr. Randy had asked a bit ago, if we would be putting some information, and I have some slides that are going to be made available at the end with both ways to learn what domestic violence is, and I have to bring attention to the End It Now campaign that the Seventh-day Adventist Church has been doing for well over a decade. And I've put that website on there for all different kinds of information about what is abuse, what are the warning signs. A lot of people don't even look for them in teenagers, and we have teen dating violence, which is as much on the rise as domestic violence is. And then we also have emergency numbers, what to do if you're in a situation where your life is being threatened, when you need to leave. You can still go to those places even when you have stay-at-home orders or things like this. So I think a lot of those resources can help. The other two things that you'll see also towards the end of these slides is that elder abuse is on the rise, as is child abuse. And again, those are two very vulnerable populations that don't know how to speak up for themselves or protect themselves. And we have to kind of lend an ear. If you know a parent at home with children, please give them an extra call and be extra nice to them. If someone has an elderly person in their house, same thing, a church member, call, ask, how can you help? Just let someone talk to you, even if there's silence on the line, just know that another being is aware of them and willing to talk to them, pray for them, pray with them, anything that they need. So all of those things, Debbie, unfortunately, we really think that the next issue is going to be huge rises in domestic violence, child abuse, and elder abuse, unfortunately.
We'll once again try to have these fairly quickly on the Lake Union website as well for those that may not have been able to jot all that information down. So following up to that question, is there anything that we can look for? I don't want to be a police state where we're calling all the time, but are there things that we can look for to help us know if somebody's in trouble, but they may not want to speak up? I want to be helpful and I want to be a compassionate ear, but from your line of expertise, what can we be looking for that we may not know otherwise?
I think sometimes it varies, and your best point is you kind of have to know what the starting point is. If someone is usually very aware and alert and cheery and saying, I did this, did that, and you notice a change. If you notice a change in the way that they're talking about their kids or their spouse. And it depends, because some people become much more withdrawn. Some people become more extroverted. I would pay attention if people are telling you they're using different substances differently. I know we have a primarily Adventist, perhaps, audience here, but you can be addicted to all kinds of things. You can be addicted to food. You can be addicted to alcohol. You can be addicted to nicotine. And if you see any changes, increases in those substances, you want to be doing it there. Also changes in behavior. And that's sometimes hard to see because we're physically distancing. Normally teachers are pretty good at noticing changes in kids, but just if you have any way to check in, especially if you can Zoom with someone, it gives them a bit more of a connection to look for changes in behavior. Again, it can go to either extreme, but when you start to migrate to either one of those ends is when we start to look for changes. Does that kind of answer your question?
Well, I think that circles back around to let's not social distance ourselves so much, because when we lose track of and what we know about somebody, if we totally isolate, then we don't have any way to find out. I have one more question that I've been hearing on the news, and that is, we're hoping that we're getting to the peak and heading down fairly soon, but I'm also hearing that, and this may go back to Dr. Kelly and Hazelton, and that is sometime in the fall, we may be seeing a spike going back up. What are some things that we can be doing now to help keep us from potentially contracting something when it comes back around? And I hear a lot of times when things come back around, they come back a little bit more viciously. So what can we be doing now to be protecting ourselves?
Well, again, I think both of us would like to share a little something on this. And so, Dr. Hazelton, do you want to go first, and then I'll finish up?
Sure. Yeah, your question is a really good one. I think we'd all love to have the crystal ball to answer that. With you know, the 18, 19, 19, there was 3 kind of waves that goes through. Will the same thing happen here? Will this COVID-19 be seasonal? Is it going to be based more on our contact with each other and the herd immunity that Dr. Kelly was talking about? Those are all great questions that I will leave it to the epidemiologists to do their best guesswork on. But your question is an extraordinarily valid one of what can we do. This is, you know, this is probably, we can view this as more of an opportunity to better our own health. You know, I think a lot of the fear with my patients is that I don't know what to do. I'm out of control. I have to, you know, I can't, what can I do? And actually there are things that we can do. Dr. Kelly mentioned some of the hydrotherapy things that may be helpful. There are some interesting risk factors for COVID-19 for more serious disease. And I think that's where, you know, we can make a difference in our, you know, whether or not we'll get a serious disease, to try to prevent that as much as possible. So this is from the CDC. Obviously, this is based on our current knowledge of coronavirus. And so those at high risk for serious disease with COVID-19 would be the elderly, would be those in a nursing home or long care facility, and also those with underlying medical conditions have not fared as well when they develop COVID-19. So COPD, serious heart conditions, like coronary artery disease, atherosclerosis, those who are immunocompromised, smoking, or they're on immunomodulators, different medications, diabetes, liver disease, chronic kidney disease that's currently on dialysis. So it's just really fascinating to me that these diseases that are, if we have them either uncontrolled or you know, we have them, they're doing more poorly. But these have been, you know, epidemics, obesity epidemic, and these chronic diseases have been on the rise, just kind of smoldering and slowly rising in the U.S. for quite some time. And so we're kind of having a compounded epidemic, if you want to call it that, where we've been having this smoldering obesity and heart disease and rising and rising, and then this virus that is really hard on those particular patients. And when you look at the actual causes of death at the last census, they took a look at the underlying causes of death behind these top killers in America, with, you know, you can see them on the left. Underlying is tobacco, poor diet, physical inactivity, alcohol consumption. These are something we can do about. We can take control of our health and do something about those. Dr. Kelly is the founder of American College of Lifestyle Medicine, and you may want to speak to some of that and what we can do about these things.
Okay, are we able to hear me? Thank you for sharing that, Dr. Aselton. And what I would like to share first, a quick comment about that, and then there's a question I want to answer about how to know what treatment to use when. But I just wanted to say that the fact is that we now know, and this is kind of new knowledge, that and the American College of Lifestyle Medicine is making a special emphasis on this, that we now know that intensive lifestyle changes can actually put type 2 diabetes into remission and into reversal. And you're going to be seeing this. There's a paper soon to be published on this. And the reason I'm pointing this out is many times we've thought of diabetes or pre-diabetes as, you know, this is my fate. I mean, there's nothing, I don't know how to do anything about it. And in fact, the American Diabetes Association for probably 2 decades or more has been saying there's no cure. Well, if you look at that website, you'll see they've removed that. that is no longer a true statement. And so I just am trying to communicate to our group that if you have family and friends or yourself with diabetes or prediabetes, which does distinctly increase your risk for serious complications if you catch the virus, you can change that. Okay, well, let me now move though to answering a question about how do we know which treatment to use and when. Again, the contrast shower is a tonic, you might call it. It is the fomentation treatments or the hot bath treatment is where you raise the body temperature and have a sweating period, say of an hour or so. That is more effective. That is more intensive, but it is intensive enough that we don't recommend that you do that every day for your entire life. You know, in fact, I really would think it would be best not to do that for more than a week or two, because you don't want to stress the body too much, overdo it. So the contrast shower, or sometimes called alternating hot and cold shower, this is used for a tonic, and you can take these 1 or 2 times a day without any issue. There's no concern there about debilitation. But with the other more intensive treatments, you do have to be more careful about that. As far as whether to use fomentations or the hot bath, the fomentation is almost impossible to do to yourself. You're going to need someone else that knows how to do this to help you. So if you're not able to have someone do this for you, then I highly recommend you use either the hot bath or a Russian steam bath. And we'll supply some links where there's some very nice YouTube videos on some of these treatments, and we'll make sure that we give those to Randy and Debbie so that they can put these on if they'd like to.
There is a question that has come in that I would like to pose here. Dr. Melissa, I'd like to find out about cultural differences, how they impact different ethnicities, zip codes, socioeconomic. Can you speak to that briefly?
Sure. Just to kind of bring it back to what I was talking about before, where everyone has a different starting point with regards to their mental health, with the resources at their disposal. We are a global church, and we have a lot of diversity within our church, within our communities. And with a lot of the diseases that the doctors were just mentioning, you have to understand that they're also not evenly spread among our different ethnic groups in the country, different levels of socioeconomic status. All of those things impact kind of what you can afford, what you can do, whether or not you have time for yourself. So for example, single parents are at higher risk of abusing their children sometimes, because if you can imagine not having another adult in the house that can help you deal with your kids, and your kids are already going a little wild because they haven't been outside in days, and you live in a 1-bedroom apartment, you're just in a very different place to be able to take care of yourself and to be able to take care of your kids. So when we think about our own groups and our churches and our friends and our neighbors, those are some things that you also want to be paying attention to. When we think about even things as simple as getting tested for COVID-19, not everyone has health insurance. And oftentimes you need a doctor's note in order to qualify for a test to get tested. So I just want to bring to light again that issue of these cultural differences, not just ethnic, but also socioeconomic status, different countries of origin, different neighborhoods, different groups. We all want to be paying attention to slightly different things. And that's why it's important to kind of know who you're thinking about, who you're working with. Like I mentioned before, I work a lot with people who are lower socioeconomic status. And if you don't have the money to, I know this is going to sound bad, but to hoard the toilet paper, like we saw at the beginning of this pandemic, if you don't have the money to buy a 20-pound bag of rice instead of the 3 pounds you're used to buying each week, you're in a very different place with regards to risk for a lot of these other issues, especially the mental health ones, not to mention the physical ones. When I teach my classes, I always tell the students, I make them do an example of what it's like to live on minimum wage. They're all very traumatized after that conversation because they realize they can't afford rent and healthy food, much less clothes and transportation by the time their check runs out. So one of the things that we want to pay big attention to here is anyone who's kind of falling into those risky groups, and make sure if we can support them, you know, if our church still has food donations, if we're doing anything like that, to be able to help as well.
I have a question for the Dr. Kimberly, Dr. John. So there's been a widely circulating article from W.A. Rubel, I think his name is pronounced, General Conference Medical Department Secretary, and I'm guessing that's the equivalent to the director today. And I wanted your thoughts on what's being said, because it seems as if there is a recommendation or a suggestion that church members should take steps to becoming medical missionaries. And part of the article, what it said was, ministers, colporteurs, teachers, and lay members have been urged to become medical missionaries. We're told that every Seventh-day Adventist home should be a small sanitarium, that every Seventh-day Adventist should be a medical evangelist, and that the medical phase of our work would be one of the last to be closed. And then it goes on to some other things, and then it says the doctor and the nurse no longer hold the preeminence they have held there heretofore. And so I wanted to get your thoughts on that, and those who might be listening, in terms of, you know, what is my role in all of this, and how can we be part of the solution and not be turning to the medical establishment, so to speak, for, you know, all our care. And this might be a segue too, in terms of some of the plans that you have down the road to help train us.
Okay, Kimberly, go ahead.
Favorite subject of mine. It's interesting that the article about hydrotherapy with the sanitarium, you know, using hydrotherapy was actually written by W.A. Rubel. So he gave that report of the fomentations, and I tried to find out, you know, from some of the Adventist history gurus, Dave Fiedler and others, who actually gave those home sanitarium treatments. Were those, you know, people that were trained by the sanitarium? I would assume there was sections of the country at that time that were training church members to give simple treatments, to do health education, to do things of this nature. And we didn't get a clear answer on that. But it is interesting the historical, what was happening at the church during that time. So J.H. Tyndall was doing something called company evangelism during that time, where he was training. When he would go into the churches, he would do cooking classes that was for the very purpose of helping the church members, but also that church members would then be able to go and help other people in the community learn how to cook and eat healthfully. To be able to give simple hydrotherapy treatments under the supervision of a physician. Let me just share quickly some of where Dr. Rubel is getting some of his comments about every church member a medical missionary. And if you read, he's getting it from a lot of our manuals on medical missionary work that was written by Ellen G. White, and this concept that physical, spiritual, and mental health are all connected. Hence, you know, I think that's reflected here with Dr. Melissa being here, and also collaborating with physicians and with the church. Is very important, and so if you look at what she talks about with medical missionary work, it's not necessarily medical that we think of today, like, you know, I'm going to go in, I'm going to diagnose you with a disease, and I'm going to, you know, give you something to treat your disease. Much broader than that. I think one of my you know, she kind of used several places defines what medical missionary work is, but Christ-like work for the body and Christ-like work for the soul. is the true interpretation of the gospel. And this should be a medical missionary work that's in the first page there of CME, our Call to Medical Evangelism. So it's a concept of helping people. It was called benevolent work before the term medical missionary work. And I'll just briefly read a quote here about what we might be able to do today, taking some of the concepts that Dr. Rubel was wrestling with, and how to apply those, what we might be able to do today. And I think Dr. Kelly may want to speak to some opportunities as in that regard as well. Let me see if this will work here. Okay. So this is one example. There's many others that we can read about in Counsels on Health and other books. This is Counsels on Health 389. The gospel workers, which each of us as Christians should be also able to give instruction in the principles of healthful living. There's sickness everywhere, especially right now with the COVID-19, and much of it might be prevented by attention to the laws of health. People need to see the bearing of health principles upon their well-being, both for this life and the life to come. They need to be awakened to their responsibility for the human habitation fitted up by their Creator as His dwelling place, and over which He desires them to be faithful stewards. All gospel workers should know how to give simple treatments that do so much to relieve pain and remove disease. I think this is a time when people are wanting to know, what can I do for my health? What can I do about COVID-19? And this is a really opportunity that people are being awakened to their responsibility, and we can be there to share what we know about health and also learn more for ourselves. It's an opportunity for ourselves to improve our health, as Debbie alluded to at the beginning. And an opportunity to learn simple things that we can do in our home, that we can recommend, and there are opportunities to be able to learn those things, and Dr. Kelly may want to speak to that.
Yeah, thank you, Dr. Hazelton. It's interesting. We hear in the church, of course, about how the work can never be finished by the ordained ministers alone. It requires every member. And it's so interesting that your question is about really the same kind of thing. In reality, we cannot, doctors and nurses are not adequate to do all that needs to and can be done in helping our neighbors. And so absolutely, I do think that as strange as it may seem to us, that more can be done to help our neighbors by the lay member than by the doctors and the nurses. And what's really interesting, there's going to be there's going to be a symposium tomorrow, 8 p.m. Eastern time. And it's for doctors, and it's offering CME credit. And what it is talking about is how little the medical profession has to use to fight this virus. And we are looking for what they're calling non-pharmaceutical interventions, okay? We don't have a pharmaceutical fix for COVID-19 or for the virus. And so it's so interesting is that you don't have to be a doctor or a nurse to help people in the early phases. Now, of course, if they do get a bad infection and it is serious, it's dangerous to avoid going to a medical professional or going to the doctor or the hospital. But there's so much that we can do before that. And so I do think that what Dr. Kimberly was just talking about in the statements are clear. And I love that about being a Seventh-day Adventist. I was not raised Seventh-day Adventist. I became an Adventist as an adult. And one of the things that drew me to this particular church is the fact that we have this understanding of medical missionary work that we as lay members can do to help our neighbors. So I totally agree. And I want to say one other thing. As a physician, as an Adventist physician, as someone with years of experience doing hydrotherapy before I became a physician, I believe that one of the things that we're told that in the Spirit of Prophecy Council is that physicians and nurses properly trained should provide an umbrella, provide oversight for lay members who want to become equipped to do this. And so if I might, I'm going to share my screen and show you this slide, the one last slide I have looking at this course that we, Dr. Azelton and I are privileged to be working with some others, but it's a hydrothermal training class, and it's a Zoom-based course, meaning the Zoom that we're using here tonight. And will teach some of the up-to-date understanding about the practical use of hydrotherapy treatments, and also some of the science. It's really interesting how the science has coming out validating the treatments that we've been sharing. The main bottom line is over here, the hydrotherapy training course at Gmail, to email if you'd like to get more information about this, or you can email me directly personally, jhkelly at CLNF, countrylifenaturalfoods.org. So I just really am happy to be a part of training people how to do this effectively and safely.
Okay, were there any other comments? Dr. Melissa, any comments? Dr. Azelton?
Sure, if I could add something briefly. I think that when we talk about everyone helping in this, it reminds me of the Bible text about, am I my brother's keeper? And in many ways we can be, and that doesn't mean I'm not an MD. I can't even take my kids' temperature half the time the right way. But when it comes to, can I check in with my neighbors about how their anxiety is doing? And I can ask them as simply, giving them a call and saying, hi, how are you doing? How are you coping with everything that's going on lately? I've just very specifically and directly opened a window where I don't want just the comment, yeah, I'm fine, answer that we tend to give. But I'm asking specifically, during these stressful times, what's going on? If I know someone who's in a position where they might have recently lost a job, hey, have you gotten that unemployment processed yet? If I'm in the position, maybe even saying, I know someone who has groceries, extra groceries. Can I drop something off? Contactless pickup, but I can drop it off on your front porch if I know of someone. So I think that even with mental health, there's so much that we can do. I will never forget being a first-time mom with twin children, completely overwhelmed, a husband who didn't have paternity leave. So I was alone with both of them, and people expected me to keep them alive. And it was just a little overwhelming. It was an endless cycle of them eating and drinking and then changing them. And then the next one would wake up and I'd get to do it all over again. And the pastor's wife, who had 4 children of her own, just showed up at my door. And she looked at me and she said, what do you need me to do? And I was still in this kind of, oh no, I can do this all. I'm super mom, right? Because I'm afraid not to be. And she goes, I'm a mom. I know what it's really like. And I was like, no, I'm fine. She goes, when's the last time you took a bath? And I was like, oh, yeah, well, you see, that's not very important right now. She said, I'll watch the kids. You run in, take 5 minutes. And I dared to ask, I was like, can I have 10? Can I wash my hair too? And it was such a big help. It made such a difference just to know I wasn't alone, just to know that someone was sharing that all people go through this, that I'm normal, that these reactions are normal because we're in difficult times. It's okay to be anxious and not know what's coming next. Even the doctors don't know. We don't know how many waves there are going to be. We don't know how long schools are going to be closed. It's okay to be a little scared. It's okay to be that. And I have to know when my fear starts getting bigger, then I need to look for professional help. But the fact is, we can all check in with each other. We can, try to find someone to help us to really try and prevent. And I think that's one way that from a psychological standpoint, we can all be missionary workers. If you have a phone, if you have Zoom, call, check on somebody, offer a listening word of advice, and just be there, be present. I think the concept of sitting Shiva is so big, and we sometimes forget how much it can help just to know that someone's sitting there with you like they did with Job, and they may not be able to fix it, but they're there with you.
Very good. Very good information. We did promise earlier that we would put up a website, an address where you can go. So if we could get that on the screen to share with our viewers, it is lakeunionherald.org. Let me see if I can see it on the screen. I have it, but I want to make sure people can see it. Yes, lakeunionherald.org/COVID-19. They're up on the address bar, upper left corner of your screen. So the information that has been presented here today, the slides, contact information. Dr. John, I'm glad you mentioned the seminar tomorrow. Yes, it is geared more towards the medical world, but anyone is able to jump on there and garner more information. We'll put up a poster there so people know how they can get onto that program as well. But all the things that we've discussed will be on the website. It may not be immediately, but we'll try to get it up as soon as we can. So give us just a few minutes or a few hours to do that. I also do want to mention there's been quite a bit of interest from last week as well as today. There's interest in other topics. So Debbie, what can we look forward to hear about next week?
Yeah, and Dr. Melissa touched on it. We're going to be talking about health disparities, because that's one of the things that we're hearing about, that certain zip codes, certain ethnic groups, certain, areas that are hardest hit. And so we are planning to have Dr. David Williams, the Harvard sociologist, who is going to be talking about those health disparities as it relates to race. And we will have Ingrid Slickers from Andrews University from the social work department, who will be talking about coping with trauma as it relates to groups such as immigrant and refugee groups. So that's what we will have for next week. So we invite folks to come back and we'll continue these discussions. But this has been good.
Very good. Well, one other thing that we talked at the very beginning of the presentation, what has changed in our lives. Hopefully this hasn't been a huge change, but if nothing else, this is much more of an opportunity to reach those that that are in our circles, even though they're not in our physical circle. Reaching out to them, we can, we may have been timid to, or hesitant to share what we know from God's word, but here is a golden opportunity we have to share, maybe not so much theology and doctrine, but I did take a look and found 3 texts that have given me a lot of peace and comfort. I've shared these with other people in my circles, just to try to encourage them in their walk and their stresses in life. But 2 are from the Old Testament, 1 from the New Testament. The first one, I think we all know, Psalm 91. He that dwells in the secret place of the Most High shall abide under the shadow of the Almighty. I will say of the Lord, he is my refuge and my fortress, my God, in him will I trust. Here's the timely verse, verse 3. Surely he shall deliver thee from the snare of the fowler and from the noisome pestilence. Boy, are we in that right now or what? The next is from Philippians 4:19. In fact, I just heard Elder Mitchell, Michigan Conference, end his presentation to the conference with this verse, Philippians 4:19. But my God shall supply all our needs according to his riches and glory by Christ Jesus. So I was blessed by that verse. And the last one, I think we all probably know this one as well, Psalm 46, verse 1. God is our refuge and strength, a very present help in trouble. So even though things may seem to be falling apart around us, we know, what's the saying? We know who holds the future. We know how it's all going to end. So the road may be bumpy along the way, but as long as we cling to his omnipotent right hand, we'll be okay.
Amen. Amen. All right, before we close out with prayer, I just want to thank everyone, thank our panelists for coming and speaking words of life, because literally, the information that you're sharing with us, these are things in terms of, it's an act of love to be able to help us to be able to live healthier lives and to be able to help our families, because we see so much around us that speaks to the fact that there is the closing of Earth's time is just drawing closer and closer. And so this is something that we need to be able to share. And so I thank you so much for coming and sharing your expertise with us. And we will close with prayer. Bow your heads for prayer. Dear, kind, and ever-loving Father, we thank you so much that we have this opportunity to learn. We ask, dear Father, that we will take this information, Father, and apply it to our lives. There is much work that needs to be done, but dear God, we ask that you will just continue to give us strength and that we can continue to look to you and your promises, that we can cling to those. And dear Father, we just ask that you'll continue to bless and direct and guide.